Immunotherapy has been developed in patients having far advanced disease, failing first line or second line of therapy, and obviously based on the good results seen, we are now moving the immunotherapy to earlier phases of the disease. So we are now analyzing, exploring immunotherapy as first line in patients having metastatic disease. In fact, there are now 4 trials testing 4 different IO agents in first line, meaning first line patients having metastatic disease, previously untreated patients. And those trials are comparing immunotherapy plus minus chemotherapy versus chemotherapy. Also, there are phase 1-2 trials with the use of immunotherapy in patients who are non-eligible for platinum-based therapy. And one of these trials have been published in the Lancet, and this is with the use of atezolizumab patients chemotherapy naive who are platinum ineligible. We have seen a median survival of close to 16 months with immunotherapy, first line single agent. So that's exciting because with chemotherapy, we usually were seeing median survivals of only 14 months, meaning that all these compounds are going to move to earlier phases of the disease in the setting of metastatic disease. But even moving further ahead, so we are now testing all these compounds in the adjuvant, in the neoadjuvant setting, and even earlier. For example, patients that have non-muscle invasive disease, high grade, that are failing BCG. In those patients, there is a phase 2 trial testing immunotherapy with atezolizumab or pembrolizumab in order to avoid cystectomy. We know that patients that fail BCG, the only solution is to indicate a radical cystectomy. So we are going to see the readout of these trials maybe in the coming 2 years. And even moving forward, obviously we know that immunotherapy is only effective in 20-25% of patients. And nowadays what we are doing is we are trying to identify biomarkers in order to enrich the patients that are going to benefit. And we are trying to design smart combinations in order to improve the results. So there are now trials ongoing combining 2 different checkpoint inhibitors. For example, I'm going to present today some preliminary results combining anti-CTLA-4 ipilimumab with nivolumab, that is a PD-1. This is moving now to a phase 3 trial. We are also exploring combination of immuno-oncological agents with chemotherapy, with targeted agents, with radiation therapy. So hopefully the future expectations for our patients is going to be brilliant based on all these advances.